You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Craig Rubinoff. Dr. Rubinoff is a board-certified periodontist. We have invited him on the program today to answer some of your questions regarding who's a candidate for dental implants. Dr. Rubinoff, welcome to the program.
Thanks for having me, Randy.
Good. Now, you're a periodontist.
Yes.
What is a periodontist?
Basically, the specialty of periodontics is the area of dentistry dealing with the supporting bone structures of the teeth, the gums, and also the replacement of teeth with dental implants.
Okay, and how long have you been in and around dental implants, working with them?
Dental implants are probably well over 15 years now.
15 years. And your website, I know you have a sense of humor because it's topgum.com. Why the Top Gum?
Well, I was in the Navy back in the early 80s, and I was overseas, and I got transferred to the Miramar Naval Air Station back in 1986, and the Top Gun movie had just come out. And the specialty plate that I had on Guam, ILBCNU, was already taken. I said, why don't be a wise guy? See if Top Gum is taking it, and it wasn't. So
you say that's on your license plate as well?
Yes.
Okay, so now your practice. Tell me about it. It's Rancho Bernardo Periodontics.
Yes.
What all do you do there?
Okay, we're in the Rancho Bernardo section of San Diego. Our practice is limited to periodontics and dental implants. The periodontal side of the practice, we're doing laser laser surgical and non-surgical periodontics.
Okay.
And on the dental implant side of the practice, working with the diagnosis, treatment planning, and placement of the dental implants. And then our restoring dentists will go ahead and place the crowns, bridges, or snap-on dentures, whatever is necessary for those patients.
Okay, now to see a specialist like you, I mean, they don't need a referral. I guess that's how you get most of your patients referred by general dentists, but they can call you directly. Is that correct?
Yes.
Does that happen?
We do get patients, they find us from our website, they find us from the phone book, or from friends who have had treatment, they like the results of your treatments, and they were sent to us that way as well.
Okay, dental implants have become, I guess, very popular.
Yes.
Have become more mainstream.
Yes, it's very popular. It's very exciting as well. We can take patients who otherwise we may consider them dental cripples. They have these dentures that are flopping around and not secure. They have to use a lot of goop or adhesive to keep them in, and they're not secure. They're not functioning well. They have food that gets underneath it. And when they smile, they're afraid their teeth are going to fall out. And with sometimes just with a few dental implants, we can have their dentures secured. And
you say just two.
Yes.
Well, we've talked a little bit off camera, but two dental implants.
Two dental implants
can give somebody like a lowered denture
a lot of stability.
Yeah. Do you think people count their teeth and think, okay, this is how many I need?
They probably think, well, gee, I have 32 teeth. If I had all my teeth, that means I need about 30 dental implants, and that's just simply not the case.
It's not the case. But has a lot changed, by the way, in the world of dental implants?
I think one of the most exciting things that have changed with dental implants is now we can do our planning and our actual surgery on a computer.
How does that benefit the patient?
Well, for
the CT.
With the CT scanning, we can pre-plan the procedure, so there's lower downtime, lower procedure time.
Okay.
We can determine exactly where the bone is, where vital structures are, so we can place the implant in the exact ideal place for to secure whatever prosthesis we're planning for the patient.
You also say that in the old days, which wasn't too long ago, sometimes these procedures would take 9, 12 months before the process was over. Elaborate on that. And why is it so short now?
Well, it's short now because, again, now we know when we're placing the implants, we know where the density of the bone is. So we can place the implant in the most secure areas. And we're finding that the implants will integrate into the bone in a shorter period of time, and we can restore the patient.
So you put the implant in, it's made of titanium, right? And what, the bone just kind of grows on it, grabs onto it?
Basically, it's almost like a chemical reaction where the bone adheres to the titanium.
How soon can they eat in an ideal situation?
Well, they can eat immediately after the procedure. It takes several months for the implant itself to integrate into the jawbone, so then we can place whatever prosthesis needs to go on.
So they're not left without teeth, though?
No.
Okay.
Patients come in with their existing denture. We can modify the denture to be able to sit over the implant without traumatizing it.
Is the number one fear pain, by the way? Because it seems like a very painful procedure.
Not really. I mean, a dental implant, it's very, very small. You see how small it is.
Yeah, this is it. You can't even see it on camera here. But so this is it.
Right. It's very small. And again, with the CT technology, we can now be more precise in our placement. We don't have to open up. Sometimes we can even do these things without even putting stitches in the patient.
So there was more cutting before?
Yes, it was
in the old days.
A lot more cutting because we had to visualize all the bones, see the contours of the bone, make sure we're in the right place. Whereas with a custom surgical guide that we get with the CT scan, we just place a surgical guide in place in his mouth, and they go ahead and we just place the implant.
Okay, what are the different categories of dental implant patients that you see?
Patients maybe just missing one tooth, like in the front, or even one in the back, missing several teeth. Patients have a removable partial denture that have several teeth missing. Patients who have no teeth. They're wearing full dentures, upper and or lower.
Now, what about somebody that has bad gums? And knowing I was going to interview you today, I talked to one of my friends. They said, well, I have bad gums, so dental implants probably wouldn't stay in my mouth. What is your response to that? Is that true?
No, it isn't. Actually, if you have bad gums and you think you're losing your teeth because of periodontal disease, once the bad teeth are taken out, the periodontal disease goes away.
Oh, is that right? Okay.
Yes. So there's no periodontal disease at that point. You get back to a healthy environment in the mouth. If we've had to take out teeth, we rebuild the lost bone. We have some very easy bone grafting techniques to do at the time of extraction. It's very important at the time of extractions to remove the infected tissue and to place a bone graft at that time for plating dental implants so the bone has a chance to grow back in a favorable manner, and then several months later you can go back and put your implants in.
Okay, something very interesting to me. You say people hold on to their teeth too long. They're told by their general dentist, your teeth have to go. And oftentimes they do nothing.
Correct. Because in the old days we didn't have the alternative of dental implants, so they try to do everything. We call it dental heroics, to try to hang
dental
out.
Heroics,
dental
okay.
heroics, to try to hang out the teeth, splint them together, do everything we can, because once they lost their teeth, we knew, well, then they're into dentures. The patients didn't want that. But if they're having problems with advanced periodontal disease, there's a lot of bone loss. It's progressive bone loss. So as you're losing bone...
So people, now they're losing bone. Is that why their teeth are a little wiggly?
That's why they're wiggling, because they have lost their bone.
Why is it they're losing bone?
From infection, because periodontal disease is basically an infection in the gum that's affecting the bone and its supporting structures.